bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
And welcome back to Comcast Newsmakers. I'm Steve Swat. My guest this segment is Micah Weinberg, who's a senior research fellow with the New America Foundation. Thanks for being with us.
Thanks for having me.
For our viewers who may not be familiar with your foundation, tell us a little bit about it. I know you have offices in Washington, D.C. and Sacramento.
Yeah, absolutely. And we think of ourselves as creative centrists, because right now, in a place like California, you need folks who are actually going to be interested in engaging with the problems rather than retreating into their partisan corners. And so we provide policy analysis to back up that kind of a perspective.
So you're a think tank, and you do research on various issues, come out with reports, and
absolutely.
Hopefully you can get the legislature and the governor to...
Reports, events, we're constantly meeting with members of the legislature and the administration and really trying to drive some sensible policies.
I know you just finished an exhaustive study of health care. Very recently. Tell us about that.
Yeah, exhaustive is right. Exhausting as well. This is a study that was the result of a process where we brought together healthcare leaders from the physician sector, hospitals, consumers, businesses, and insurers to figure out how do we actually control costs while preserving quality. And what we came out with was a plan to save the state $305 billion over the course of the next 10 years.
Well, we ought to repeat that. It's $305 billion with a B over 10 years.
Yes.
And that's just in the state of California.
Just in the state of California.
So what are your recommendations?
Sure. Well, there are a bunch of different recommendations, but let me start with something that people will understand pretty well. The fifth leading cause of death in the United States is actually healthcare-acquired infections. So when you go to the hospital, it's a pretty dangerous place to be sometimes, and a lot of folks get sick. And there are things, simple things, that hospital administrators can do to make sure that people wash their hands and other techniques. And that helps to reduce the number of infections that are acquired and therefore the cost of treating them. And we estimate that dealing with healthcare-acquired infections alone will save the state $19 billion over the course of the next 10 years.
That's in terms of $19 billion in emergency health care that has to go to some folks who weren't sick when they started?
Absolutely. Or unnecessary readmissions to the hospital because they contracted some sort of a condition. Now, when we say savings to the state, we're talking about all of Californians. So these aren't really savings just within the state budget. It's premiums that people pay, out-of-pocket costs, and so on.
It's hard to believe that, basic cleanliness is missing in some facilities.
Well, it is hard to believe, but it's nevertheless true.
Did that shock you and your researchers when they found that?
Everything about healthcare that I learned shocks me.
Really?
Pretty much anything. I mean, there are a lot of wonderful things that are doing in physicians' offices and hospitals around the country, and I think that these people work extraordinarily hard and have a very difficult job and are to be commended for the work that they do. But in terms of how we do the policy, in terms of how we set up organizations to deliver health care, we do a lot of things in a pretty backwards way.
Okay, so you talked about washing your hands, basic.
Sure.
What else? That's
okay.
$19 billion.
Yeah, exactly. So the biggest savings come from paying doctors and hospitals not for the quantity of things that they do, but for the actual outcomes that they produce. And that allows these groups of medical providers to become more efficient and provide higher quality health care to the people who see them.
And did the physicians involved in your report go for that?
Yeah, absolutely. Now, California has a long history of groups that have this precise orientation. So say, for example, here in Sacramento, there's a group called Hill Physicians Medical Group. And they're the largest independent practice association in the whole country. And they have made these sorts of this is the way they've been paid for years and years, and they've been focusing on these quality initiatives during that whole time.
That's fascinating. What's your next report going to be?
Well, a lot of my focus right now is on, so we want to achieve certain outcomes over the long term. But right now, we are decimating our delivery infrastructure through making massive cuts to the state budget. And that's penny wise and pound foolish.
Well, we're just scratching the surface on this subject. We'll have to have you back, and we'll talk about the budget angle also. But Micah Weinberg of the New America Foundation, thanks for being here and talking about this really very important issue and report.
Thanks for having me.
And thanks to our viewers for watching Comcast Newsmakers. We'll see you next time.